everyone. Stephanie again for our final segment with Montessa Lee, who's sharing her small cell lung cancer story. The great part of where you left off was that your scans have been great for years. Unfortunately, of course, because of the radiation to the chest, you are also having to now deal with the scans for just in case for breast cancer. But so far, so good. And that's what we like to hear. And one of the most important things I like to talk about is, we talked about all the physical, medical sort of parts, but it's really being faced with this sudden change and how you got through it mentally. I know you mentioned faith. In addition to that, as such a powerful motivator, what got you through the long hospital stay, especially in the beginning when you're going through all the tests and then going through chemo and then radiation and then more radiation? How did
Mhm.
you get through it all?
And I think it's important that something else I had to learn was swallow your pride and don't be afraid to ask for help. And so even like explained that day when I was fatigued and having to go walk to my neighbor's apartment, it was because when he gave me a week off of that chemotherapy, it got my chemo schedule off, and I had already had rides scheduled, and so I had to go ask. And our church was having a big event. It happened to be that week that I would end up having chemo, and so I had to go ask my neighbor for a ride, and just to swallow my pride to say, "Hey, you need help. You can't do this on your own. You can't live in a silo." And reaching out to I had the friends that supported me, my family, extended family, and family, and the church family as well, to help me. It was a big part of it. And then finding something to do, like a hobby. I remember doing some arts and crafts, and my cousin, I first was diagnosed before I knew how long I was going to be home. So you're here kind of like now everybody knows what it's like from being in this pandemic, but being home, and when you're used to being out, or out on the go all of the time,
Right.
finding things to do, and pick up hobbies, read books. I read a lot of books and picked up different hobby. I actually picked up painting now, which I've done as a hobby at
Wonderful.
one of these hospital stays, well, a later hospital stay,
Yeah.
when you're doing a checkup. So just finding things to have an outlet. And I was using a lot of Google Doctor, to find, but that might not always be a good thing. You probably have to have your time limit of what you read on the internet, as far as medical concerns.
But I love your message of don't be afraid to ask for help.
Mhm.
It's hard, right? It is hard. I think people don't. It's so interesting to me how many people who've been diagnosed, one of their first reactions is just, I don't want to be a burden. I don't
Yeah,
want to be a burden.
yeah, y-
um,
yeah. It's hard to realize, because especially if you're young, or even if you're older, independent person,
right.
and you go to wow, I can't drive. I probably, I'm like, I'm too loopy. I can't drive. My mind is too drowsy. I can't do it.
Yeah.
Um, or I'm not feeling well. I need help. I need, somebody to bring me some groceries or food, and things you don't think about. Just the care of people. You really find out who your friends are too. I mean, and also understanding what some people can deal with, because some, it's like one of my brothers didn't want to see me bald, or
Mm.
he didn't want to see me in that state. He wanted to visualize me as he, I don't want to say knew me before, but before the sickness. That's
Right.
that's the picture he wanted to maintain in his mind.
Yeah, I'm glad you brought that up too, just because you can't control other people's reactions,
Mhm,
and how they deal with it. It's very difficult, but just to try and focus as much energy on yourself, right, as
mhm,
possible.
mhm,
And along these lines, I'd love to hear your thoughts, your message to everyone who's watching and reading this on just advocacy in general, right? Self
mhm,
advocacy. I'm going to bring up a picture of you in that little boxing, outfit, but it's
uh-huh,
just a very powerful message. I think people need to hear.
mhm. Yeah, and I think, you can't be afraid to be a self-advocate for yourself, and that means asking questions, and if you don't know the questions to ask, have somebody there with you. I met a couple recently, and the wife was kind of too emotionally distraught. So I told her husband, I said, "You're going to have to be the one to ask these questions, now, right? And now, because I've been doing the lung cancer advocacy, I was able to give them some questions. And this is, my mom and my sister with me, as a celebration of life at one of the, when I started getting treated at the cancer treatment center. So they're there, and this is a fight. I think, I don't know if people realize that cancer is, um, it's a journey, but it's also a fight. And so, you put your boxing gloves up, and fight whatever comes at you. Imagine a boxing bag in front of me, kickboxing bag or whatever, and punching it down. Yep. So lung cancer can't defeat you. There's a famous poem about that. What cancer cannot do,
Mhm.
and it can't. It doesn't define you. I'm not just a cancer patient. I'm so much more than that.
And you have done that so well and so much, especially in this transition. You went full throttle and then dove into the advocacy work. So I'd love to talk about that. Um, what is it? What are the top couple of things, that issues you'd like to spotlight? I love talking to advocates because you're such a bridge between the patient and caregiver population, and then a lot of like the research and medical stuff going on over here. So yeah, what should people, especially with small cell lung cancer, know about right now?
Mhm. And yep, and I think it depends on what your focus is when you come out. And at the time in 2006, when I started reading all that information, of course, it was bad, and I saw that the bridge had not been moved in the way we treated lung cancer patients. Period, non-small cell or small cell, and so I was angry, and I turned that anger into advocacy and having a voice. And I saw when I got into the advocacy work, I would go to these conferences, and then I saw that there was a lot of things for non-small cell. And if people think about it, in the last 5 years or so, there's been a lot of advancements for non-small cell lung cancer. If you turn on your TV, you could see like a Keytruda drug announcement or other commercials, advertisements for lung cancer treatment options for non-small cell, specifically for immunotherapy. And we were waiting, and that's one of the things we chose. It was another girl that was at this conference with me to do some of the CDMRP work, and because we wanted to focus on small cell, say, okay, look, some drugs, something's treatment. We're not going to be the Cinderella stepchild of lung cancer. Let's get this out here. And I started to realize there weren't many of us, that had small cell that are still surviving. And so we wanted to give that voice. And some of the other advocates are like, let's show them survivorship. Let's show them hope. And I want people to know that if your doctor tells you go home and get your affairs in order, which is what I was hearing for some patients in 2006. And matter of fact, I just heard it but he didn't have lung cancer; he had another cancer. They told him the same thing, and I'm like, nope. I said, your doctors aren't God. Nobody knows. And sometimes I think your mental state can help you through that survival. So who you surround yourself with, if you get involved in some of these groups that have the same cancer as you have, you can hear stories like, how did I get through the hair loss? How did I get through the neuropathy? How did I get through this? What stories did I read? And so you have somebody who's walking through the journey with you. Your family is fine. They're there. They have their own journey as being caregivers, but somebody who is walking that journey with you or has walked it, I think it's very important that we get connected. And I guess connected is a key word. Just like, when I had to swallow my pride, you need to get connected with people or a network of people. And I know some people don't want to do that. They want to keep it private to themselves, but think you have to find someone, even if you go to a therapist, therapy is not bad, to get someone to talk to,
Right. That
and
outlet.
keep your whole person, your mentally, spiritually, physically back whole and healthy.
Absolutely. That is such an important message. And I
Mhm.
love what you're saying too, is find that community.
Mhm.
Our caregivers are amazing. They're
Mhm.
heroes. They do so much. But there's also a limit to what they will understand on a maybe emotional and mental level when it comes to this experience.
Mhm.
And so finding that community. And that's where I think social media has been really great. One
Yeah,
positive area, right, is the
right.
ability to find people virtually like that.
Mhm.
So in the advocacy world, so I know you were just talking about, say, the therapies and immunotherapies that are happening, a lot of them for non-small cell. What's your message to industry about small cell, cancer, and the importance of getting that representation and research done?
Well, I think we are on the verge, and this is what I've recently, you cannot imagine how many times I've been contacted in the last 2 months. And I know that we are on the verge of, I think it was in 2019 that Tecentriq was made, like did this from Genentech, a immunotherapy drug for small cell lung cancer. I think it was 2019. Now the dates are blurred together, but I'm glad that this is what I've been waiting for and seeing. We are on the cusp of seeing options being plural as treatment options for small cell lung cancer. So, I just can't wait to see that they're going to be X amount of genetic biomarkers for small cells so we can have targeted treatment. How did we know? You know, yes, I had faith and I heard that word too, but how do we identify these other patients that might um, be 12 years down the road with the regular treatment option that hadn't changed in 30 years
Right.
versus the people that will work with this immunotherapy drug. And I hope they have hope. There's a new group of small cell lung cancer patients, I think, that are bring a voice to the advocacy as well, that had an EGFR mutation that then transformed over to small cell lung cancer.
Mm.
And at one point, a researcher told me to even, but the tissue samples weren't around to go look at my tissue samples and have them re-examined to see if by chance I had an EGFR hormone, mutation, and it transformed. But by then, the tissue samples weren't around.
Right, right. And that's a great message too for people who are watching. Just is if you're in the earlier stage or whatever, just to get that testing done,
Hmm.
the genomic testing, and just to figure out if you're positive for a particular mutation, because there is more precision medicine
Yeah,
coming.
especially for non-small cell. I don't know if they automatically do it for small cell, but I think we're on the cusp of that happening. All they've realized that so we have a stigma in the lung cancer community associated with smoking, but there's also what I saw as the stigma at that point. Now things are changing, but with how much focus was on non-small cell and how limited. Of course, we are the smaller percentage of people, but 10% of the people that get small cell, that's still a lot of people that will be
Absolutely.
diagnosed with small cell lung cancer.
Right. And cannot, should not be ignored.
Yeah.
So moving towards wrapping this up, I mean, what's your message? Actually, before we go, I also really want to highlight talking about the diversity aspect of this, right? And getting representation in both research and in just talking with patients of different backgrounds.
Mhm.
You are passionate about this, so what would you like to get across here?
Yes, I want, and I met about two or three during this journey because I want more African Americans to get involved. And my passion for advocacy and the focus area has shifted some. Even starting with me wanting to get the voice out that young people could get lung cancer. I think we're already there, but now how do we get into the communities where minorities are affected more, or is deadlier for some of us? What are the comorbidities? What do we do? How do we go to these clinics and tell people your tumor should be tested? If you go to your local community hospital, you should get the same standard of care as if you're going over to a university hospital.
Right.
So um how do we educate them? Again, starting with working with special needs and being an advocate for small cell and lung cancer, period. I see myself as a fighter for the underdog. And
Yeah.
so you have this voiceless population sometimes that like. And so now, if I when I'm going for my checkups, I was down there telling the gentleman, that was there with his wife who couldn't, and they were a minority couple, but she couldn't handle the information. I said, nope, you need to ask them this, and this, because they were saying, oh yeah, their community hospital. It sounded like they were trying to talk to them like, oh, we're just going to do this, not really explaining anything to them. It sounded like they hadn't even had genetic tumor genetic testing done, but they were already treating it like they had a mutation. And I'm like, they never told you any of this, so again, I would be becoming irate and enraged, because regardless of who you're talking to, you should have somebody, even a layperson, be able to explain it to anyone that comes into your hospital or clinic.
Yeah. Well, I
Mhm.
think part of the way that we get to more communities too, underrepresented communities, is by spotlighting stories like yours, right? When people see that you're sharing your story and, oh, I can relate to her on this level, I
Mhm.
think that's extremely powerful.
Right.
So
And
hopefully
I had
more.
I had an example related to my, the follow up for my
Mhm.
breast cancer, side effects from the radiation. When I first went to get the scans, the radiologists were like, "Oh yeah, you have dense breast tissue," which is common in African American women. My OBGYN doctor called me after she got the results. She said, "They might tell you that and tell you to come back in 6 months, but with your history, I would go see a breast surgeon. And so, just like that. So having a stereotypical mindset that, oh, it's
Right.
common to, you're young, you're an African American woman, you have dense breast tissue, just come back in 6 months, whatever. Not being thorough enough until, and I would not have known. Again, I'm like, okay, you know,
Right, we're here, we're listening to the medical professionals, right? So,
right.
like, "Yes, ma'am. Yes, sir," whatever you
Hmm.
say.
Yeah. Yep.
Okay, yeah. So we'll continue to work on this. I'd love to work with you more too on all these different issues. They're so important.
Yes.
And yeah, I can't wait to put your story up. If you want to find Montessa's story, her full story, it will be on thepatientstory.com. And we'll put a link to with a picture of the book that was your journaling, your healing. But if people want more of insights into your mind when you were going through cancer, that would be a great way, is the book. Any last thing you want to say?
Oh, no. Well, thank you for having me. I've enjoyed our time together. And thank you for lending this voice for patients and people out there so they could, find a landing place.
Yeah, that's the hope. Well, thank you. You make it possible. So that's it for us at the patient story for today, where you can go to find human answers to your cancer question.